कर लेना इसके ऊपर
सर का है ना. A very good afternoon, good morning to all. I, Dr. Snelata Gajbiye, on the behalf of Department of Pharmacology, AIMS Nagpur, welcome you all to this scientific session. We have today with us our distinguished guest speaker, Dr. C.M. Kamal sir. As we all are aware, the CBME has directed outcome-based education and has focused on specific domains of competence. And there is emphasis that the course must ensure the attainment of various competencies. And for this very important topic, we could not have had a better speaker. We have with us Dr. C.M. Kamal sir today, and he will throw light on the topic competency-based medical education in postgraduate training. And along with him, the moderator for this session is our very own Dr. Ganesh Dakle sir. We thank Kamal sir for accepting our invitation and also playing a key role in AIMS Nagpur hosting the NAPTICON 2024. I request Dr. Dakle sir to please welcome our guest of honor, Dr. Kamal sir, with a floral bouquet. Today, we also have faculty members from Government Medical College, Nagpur. We also welcome them. I request Dr. Anand sir to kindly welcome Dr. Mrinalini madam. Now, I request Dr. Dakle sir to address the gathering.
Good morning, everybody. Today's speaker and my dear friend Dr. Kamal sir, who is also the National Coordinator for Association of Pharmacology and Therapeutics. Participants from GMC Nagpur, my colleague Dr. Munani Kadikar, my faculty members Dr. Anant, Chetali, Sneha, and our dear PG students. Today we have gathered here to focus more on competency-based medical education, especially in MD Pharmacology course. All of you know that recently NMC has given new guidelines for PG curriculum. As compared to the previous one, they have included some new topics like minimum of 10 lectures per year by the faculty to the postgraduate student. Then journal clubs, seminars, symposium, they have defined specific numbers for each month or each week. Along with that, they have included also the bedside clinics. So what is that bedside clinic? What is the meaning of that? How to conduct it? It will be more focused by Kamal sir. Then interdepartmental activity, how it's to be conducted. Along with that, one more specific they have mentioned regarding the district residency program. So how it is to be there, how it is going to be useful for the all PG students. Along with that, they also included logbook and importance of that logbook for the postgraduate student. And not only that, they have also included 2 presentation and at least 1 published or accepted paper in the reputed journal. So all these are the new inclusions they have made by the committee, and that committee constituted by renowned persons, Dr. Badiyal sir, Chetna madam, Geeta madam, and 1 or 2 more persons. So to focus more on the topic, today we are having Dr. Kamal sir. He is a very interested person, not only as far as NPT is concerned, but he has more enthusiasm regarding postgraduate student as well as the undergraduate student. When I go into the detail of his any lecture, whether it is GI tract or thyroid, sir has sent me 1 or 2 lectures, and I have delivered the same lecture to my undergraduate students. They were very, very happy because sir has included everything in that slides, because it takes 2 to 3 hours to make it more wonderful. So such is a sir. So I request sir to focus more on today's topic, that is competency based medical education in postgraduate training.
Department, Medical College, Saharanpur. Saharanpur. Founder also, that is our, and this has been acclaimed all over the country. We now for
ये connected नहीं है लेके जाएं. This is not connected. Yeah. शुभम क्लोज कर ऊपर से क्लोज करना है ये शिव Good morning, all. Esteemed dignitaries on the dais, very close friend of mine, Dr. Ganesh Dakli sir, Madam from GMC, and the students of the GMC and other students of MD Pharmacology. It is really an honor for me to be here at All India Institute of Medical Sciences, Nagpur, to deliver a session on this important topic. Various aspects that have been changed, MD Pharmacology curriculum, or related to various things that are coming into limelight nowadays after the implementation of competency-based medical education by National Medical Commission. From the National Association of Pharmacology and Therapeutics, I would like to convey my sincere thanks to be invited me over here, to give me an opportunity to speak on this session. And we will try more and more be having some kind of the interaction during the session also. And I hope majority of the postgraduate students would be the member of the WhatsApp group also. You all are the members of the WhatsApp group also? Yes, so those who are still left, we will be including. I am happy to announce from this platform that today NPT is representing the majority of the medical pharmacologists of the country, where in the NMDP, head of the department and senior professors and another distinguished faculty, we are having 350 faculty members. Among them, 250 head of the departments from Kashmir to Kanyakumari, Gujarat to Arunachal Pradesh. And on the repeated requests from our postgraduate, we have started 3 groups because there were limited capacity of including the number in WhatsApp. So I'm happy to announce that today we are running 3 WhatsApp group of MD postgraduate students. Very overwhelming response by them all. We are being constantly, we are posting the various updates related to pharmacology, clinical pharmacology and therapeutics, various kind of the useful sessions, another resource materials. So a MD pharmacology student who is sitting in Kashmir, he can be directly connected to the faculty who is sitting at Kerala. So gradually we are trying to reduce the distance for the student and faculty member resource and the persons who are learner. So welcome to all to National Association of Pharmacology and Therapeutics. Before I can proceed, over here I would like to play a small video that is the promotional video of NPT. Thank you. So today we are connected to more than 2,000 MD pharmacology students or either faculty members from all over the country, and there are lot many developments since the National Association of Pharmacology and Therapeutics came into existence. We have covered several milestones. We have organized very successful workshop where more than 500 of the MD pharmacology students, it was probably the largest gathering of all the time, and it was very successful. And next Nepticon is going to be announced in Lucknow, and fortunately the from next to next Nepticon is being proposed over here at this the city of the Diksha Bhumi, Nagpur. So we are also be preparing for that Nepticon also, and in meantime we are working on our own journal that will be named, has been named as the National Association, National Journal of Therapy and Therapeutics and Pharmacology and Therapeutics, National Journal of Pharmacology and Therapeutics, and we have chosen the best of the publisher, Walter Kluwer, for that. And soon the journal's printed copy will be available to all, and I feel it will be again a milestone to the field of the pharmacology and therapeutics. Today, one milestone again we are covering through this guest lecture. We are covering another milestone, that we are giving this live session to the entire country. So the session is being telecast from Kashmir to Kanyakumari, Gujarat to Arunachal Pradesh. I don't know how many of the pharmacologists may be viewing this. We are having official live channel of the National Association of Pharmacology and Therapeutics. Again, thank you very much for your enthusiastic response to the National Association of Pharmacology and Therapeutics. And with these words, I am coming to my topic. Can somebody help me out? Yes. So today's topic of discussion is the competency-based postgraduate training in MD pharmacology. So in this presentation, am I audible? Probably I am having little louder voice at my institution also. So in this presentation, we will be discussing the current scenario, what is happening, area needed for the improvement, and newer NMC guidelines, what they are saying. The most important challenge before us, how we can correlate bad side to the pharmacology. Again, very much challenging task, and each and everybody among us is excited about this, that there is a lot of gap between the bad and the pharmacology. We need to address this issue, and there are some suggestions, reforms that can be taken into care in various departments. So medical sciences is changing almost on weekly basis. You will agree with me, and important question is, are we changing our training with the time and demand? So probably not up to the mark, not up to the time and demand, and even they are also saying that it is the time to upgrade. So our MD training program are adequate for the students, satisfying their future career? Can we have some input from the postgraduate students themselves? Your good name? Your which year?
Sir, I am assistant professor.
Assistant professor. Your view on this? Are we MD training to our MD adequately?
I think, sir, there should be a skill-based education, or skill should be included.
Skill should be included. pharmacology student? You are a pharmacology student? Which year? Your good name?
I'm Dr. Kritika Miller. I'm a JR1.
Yeah. So what do you think, why you are choosing MD pharmacology? Why, there are certain things?
So I want to work as a medical advisor in future. I want to go to
Okay.
pharmaceutical industry.
Pharmaceutical industry, okay, very good. So we need to address where our students wanted to go. See, as a pharmacologist, MD pharmacology, gone are the days that when MD pharmacology career were only limited to the teaching faculty. Now there are a lot of avenues that are available today, and with these opportunities that needs to be taken into consideration, there are lot many scopes with the MD pharmacology. We do agree that many of us are going to become the faculty members, but pharmaceutical industry is also open us pharmacovigilance areas. Then there we can be taken as a specialty. I have myself worked as a clinical research physician in Manipal, Bangalore for more than 6 months. I am having the exposure of the industry, fortunately. So we need to train our students from the point of view that various tasks that are being given to the MD students to all these fields, to the clinical research area. Again, there are many jobs that are coming up to the pharmacovigilance. Many students are choosing those areas also, as a medical advisor also. And in the regulatory bodies, there are many jobs. Apart from that, National Medical Commission have opened the clinical exposure also to the MD pharmacology students. It is in the various form suggested. Maybe it is in the district residency program, and I will be in the coming slides I will be discussing that there are time slots that have been given to students to work in various wards. In the ward of the medicine, dermatology, oncology, microbiology, biochemistry. So a student needs to be given exposure related to that. So my personal opinion is that as such, we need to prepare our MD pharmacology students ready for all the kind of the career, ready for all the kind of the challenges that they are going to encounter in their life. And unfortunately, if there is no job available, or student quit, that he is not interested in taking any of the job, see, as an MD pharmacology is probably the best person from peri and paraclinical branch. If you are comparing it with anatomy, physiology, biochemistry, even pathology, microbiology, none of the branch is complete. MD pharmacology is a complete branch. Why it is complete? Because we need to study physiology, we need to study pathology, we are having the background knowledge of the anatomy also a little bit, biochemistry, so pathology obviously. So it is all, and drugs are with us. So it is almost a complete branch in peri and paraclinical, and it is a bridging. It is bridging the gap between the clinical branches and paraclinical branches. I have seen successful practitioners who are earning like anything. They are MD pharmacology and they are doing practice. So we need not to feel any kind of the thing that any kind of the opportunity that is coming to us, we need to prove ourselves. And in that sense, MD pharmacology as such is the complete branch. So carriers of the MD pharmacology may be teaching faculty, as I have already discussed, pharmaceutical industries, then clinical research organizations, ICMR, then regulatory bodies, pharmacovigilance, family physicians. Many of the MD pharmacology people with the MD pharmacology, they are excellently doing the job of the diabetologist, and they are in many cities. They are very successfully running their diabetic clinics. So this is again a small video which is exploring opportunities that are available to us. So at the request of our senior faculty members, when at the time of students were waiting for the various seats to be out, counseling process, we have released this video to attract the students of the need towards more and more students to be taken pharmacology as a career. So there are the 6 steps when we are covering or we are making the curriculum development in the pharmacology. It starts with the identification of the problem. Then we need to address the targeted need, and that needs to be assessed. And then there are the goals and objectives that needs to be defined prior to define any kind of the curriculum. Same is true with the MD pharmacology also. And then their educational strategies needs to be devised, and it is the 6 steps. After educational strategies are devised, then we need to implement them successfully, and then after implementation we need to evaluate all these strategies. Then the whole of the cycle is being completed. Same is true, and this is the pyramid that is showing you the mastery. Probably you have gone through it in the medical education. I will not be going into the details against it. It is going from the ignorance and going pyramid is covering till we become master. So there are the various steps: unconscious, incompetence, then conscious incompetence, then conscious competence, unconscious competence, and reflective competence. Reflective is when the most of the things have become on our reflexes. So it is the mastery. Say for example, like a surgeon who has done these thousands of the surgery, then he needs not to think of doing the surgery. It is on the spinal level. So these are the level of the mastery. So with the specific learning objectives that have been devised with the MD pharmacology is the acquisition of the knowledge, acquisition of the skills, then teaching and training, then research and professionalism, ethics and communication skills have taken a paramount importance among all of these. So these have been defined by the NMC gadget, and it has been divided into 3 parts. If we are having a detailed look on that, it is covering the cognitive domain, it is having the affective domain, then there are the psychomotor domains. It has been advised in the cognitive domain that general systemic pharmacology and research related topics need to be covered. I will not be going into the details because all these things are mentioned in the textbook also, elsewhere also. We will be having some more attention on the affective domain related to adverse drug reactions, how we can explain if adverse drug reaction has happened to any patients. We need to teach the fellow clinical doctors who are working in the various departments. Then we need to develop rational use of the medicines. We need to explain how the various medications needs to be used. Maybe it is the diabetes medicine that have to be explained, or the device of the asthma. A patient is taking, asthmatic patient is taking the device, meter dose inhaler, proper use of that. Then Medication adherence is a very important problem because during the follow-up course, what are the various medications that are being prescribed by our fellow physicians or the clinicians, the patients are not sticking to that. Once they are getting the symptomatic relief, they are not continuing the medications, and it becomes a very, very serious issue if the person is suffering from some kind of the disease where continuous medicine needs to be taken, say for example in tuberculosis. Same is true with the diabetes. If diabetes patient is not taking continuously medicine, he can land up into the various complications. So medication adherence needs to be taken into consideration. Then drug interactions, awareness about the various generic drugs, interaction with the patient and healthcare professionals. Then in the psychomotor domains, independent or part of the team or interpretation of the results, they have divided it into two categories. Previously, these categories were not existing in the NMC guidelines, mandatory and desirable. And from mandatory and desirable, they have clearly defined that these are the things that are mandatory for the, or that are expected from the MD students when they are passing the exam. And certain desirable things can also be covered up. So dividing into them into two categories give us a clear cut guidelines or idea that we need not to put our energy or unnecessary things. We need to cover the important thing first, and then if we are time is left, then we can cover the desirable things. Then writing the rational prescription. As a pharmacologist, we are quite aware of this. Prescription analysis, audit, no need to explain, we are already, some institutions are already doing prescription audit, prescription analysis. We are also teaching to our undergraduate students. Then preparing the drug solutions have been given in this, and use of the various equipments, analgesiometer, physiograph. We must be a little bit conversant with these, so that if after going to somewhere in laboratory we are getting an opportunity, at least we must be aware of. If we are not master, we should be well aware of what are the various parts, how it is working. At least as an MD students, each and every MD student must be conversant with the ECG. You will agree with me that in the students who are choosing the industry as a BE physician also, so ECG is and other life resuscitation measures are various measures that students are learning after they are completing. So it is our moral responsibility so that we can teach and train students in their curriculum itself. So ECG is a part of that, preparing the drug solution. Then presentation in classroom, clinical meetings, we are already doing this. Students are also doing this. Determining the various parameters related to dosage, EC, ED are also important. Then in the psychomotor domain, they have clearly defined that are the mandatory aspect, that ADR causality assessment is mandatory for the students, prescription audit, use of the equipment, preparing of the drug solution, presentation in classroom, critical appraisal of the research paper. We are organizing various workshops related to that, how we can critically appraise a research paper. See, there are two things, presenting a paper and its critical analysis. Our job is critical analysis, not just presentation of the research paper that is being done. Evaluation of the drug promotional literature, again it is containing two parts. If I am talking about the undergraduate student, we are not going into the depth analysis of the drug promotional literature. But as far as postgraduate students are concerned, we need to teach or train them each and every aspect. They need to measure the font size of the various brand name with the scale, and then what are the various points, whether they are making false claim in their prescription, in the direct prescription literature, direct promotion literature, we need to identify, as a student, we need to identify whether they are unnecessarily pushing the drug, where they are trying to satisfy clinicians or pushing their drugs. That are the various things that needs to be covered. And preparing the document related to package industries that our MD students have told that she is more interested in going to. So this is a part related to that. Pharmaceutical industry, they themselves on day one will give you the exercise that you need to prepare a package insert. So if all these exercises can be done during the curriculum or during the training course, it will become an easier job. And you will take my words, all these inclusion of all these measures will make MD a very challenging, very, very interesting branch, as such, very interesting field. Then there are the psychomotor domains which are mandatory, needs to be covered, clinical pharmacology exercises related to memory, some psychomotor, pain, cardiovascular. These are being taken with the DM clinical pharmacology students probably, but some of the exercises have been shifted to the MD pharmacology curriculum. And we can organize separate session on that, but these are the part of the MD curriculum now. Exercise related to the therapeutic drug monitoring, probably we are already aware of it. Some of us are doing it in our department. Exercise related to antibiotic stewardship. So, National Medical Commission has made it mandatory the posting of the students in the various wards, microbiology department also, and that can be clubbed there. It is to sensitize the students towards the antibiotic stewards program, preparing the drug document SOP related to technique used in pharmacology research and clinical trials. I am able to recall my days when I have entered to the Manipal Akunova on the day one. They have given me the exercise that I am able to recall, feasibility exercise. They were doing the exercise or clinical trial that was related to phase 2, and we need to find out, I need to find out whether it is feasible. Feasible on 4 centers. They have chosen prominent centers: All India Institute of Medical Science, New Delhi, CMC Vellore, Apollo Hospital, Hyderabad, and KGMU, Lucknow. So I need to travel there to meet to clinicians who can be taken into investigator, and after the exercise of almost 7 days, I need to prepare a dossier and need to give whether this study is feasible or not. This kind of the SOP we need to prepare when we are working in the industry or the clinical research area, that are separate to the various assignments that are being given to the faculty members. So these are little bit different things. And skills related to scientific writing, protocol writing. Sir was telling me that even doctors for the protocol writing, that just for protocol writing they are asking 14 lakhs per protocol. Is it true, sir?
Yes, sir. Whether it is for phase 2 or
phase 2. You can imagine how much is the cost. So, as a pharmacologist is very, very precious person, precious entity. They are asking 14 lakhs for writing the phase 2 clinical trial. We are getting many various queries on the phone call, through the messages also related to this animal experiments. And I don't know, many faculty members are interested in the animal experiments, but scenarios have been changed. Students who are passing initially the MD pharmacology, they need to go to the various industry where their job was little bit related to the bioassay also, but gradually all these exercises are being withdrawn. And the current status that have been devised by the NMC is saying that animal experimentation is desirable, it is not mandatory now. So it is a good news for those residents. Many residents want to do their thesis in clinical related subjects, clinical specialty, and I feel they should not be forced by the senior faculty members to do their thesis on the animal experimentation. So as such, these are the guidelines that all these animal experiments must be compliant with the regulation of the Government of India, notified from time to time. And amphibian, dog, cat, all these experiments, we can give them little bit idea through the computers assisted simulation. There are the softwares available nowadays, and students can be given, they can be given idea. They, at least they must be well versed with how animal experiments are performed. Okay, and if those faculty members who are very much interested in the animal experiments, there is an option with them that they can maintain an animal holding area. This is the separate animal holding area where for one day animal can be kept, they can be perform experiment, that can be returned back to that. So that is also an option, but all these should be according to the CPCA guidelines. And animal activists are very active nowadays. They are taking into cognizance, into consideration, where the laws related to animals are being encouraged. So teaching learning methods have been a lot of discussion. Probably one by one you will be able to tell me, probably demonstrations are going on everywhere. Okay, for PG teaching I'm talking about. Symposiums we are doing, clinical meetings, not necessarily in all the institution clinical meetings are not doing, but it is the guidelines. We can combine these clinical meetings with the other department, in collaboration with other departments. And what can be done is, see, clinical departments are already doing clinical meetings. So we can tell our faculty members or our students that they can occupy, like they are occupying the back row chair, they can occupy chairs, they can observe, and as an observer they can keep on making their notes. So nobody is hindering their atmosphere also. Atmosphere is being maintained, they will happily allow for that. So clinical meetings are quite possible. There is no hindrance to that. Seminar we are already doing right from the beginning. This is old practice. Small group discussions, we all are involved through UG experiments also, through the UG curriculums. This is the important thing, bedside teaching. Unfortunately, we are not touching bedside teaching, and we are at National Association of Pharmacology and Therapeutics. We are constantly working to address this area, this domain. We are planning first a pilot study in one of the medical colleges we have chosen. This year, we will be training to faculty members. We will be choosing a batch of the MD pharmacology students. We will be, we can take the exam what we have given the training. We are not authorized or not supposed to ask a student for which we have not given the training. So first we are giving the training to both faculty members who are going to be the examiners, other faculty members also, and postgraduate students who are participating. We need to train them. After training, as a pilot study, we will be taking them to the wards near bedside. How it is being done, we are preparing a blueprint related to that. Soon it will be going to be successful. Once the pilot study will be successful, we will be opening it, and we will be sending recommendations to the National Medical Commission and Government of India that we are ready for bedside clinical teaching of, first we are trying it on the MD pharmacology student, then we will be opening it to the UG students also. Okay. Then case-based learning, probably some of the institutions I am in contact, they are trying this. So in the case-based learning, it is not needed that you need to take out the case from the ward. Only related documents, informations related to the various kind of the drug that are being used are only required. If you cannot take out the drugs, each and everybody is having this device with us, And I have successfully implemented at my institution. To UG students, I have told them, any opportunity you are getting to visit a bedside patient or any patient in your own family, take the picture of the medications. Probably you will agree with me. See, they are a little bit different. Milnali madam, I have met several times on the online, and today we are meeting face to face. So there's a little bit difference. So you might have heard several times, 100 times of metformin tablet, but you will agree with me, the day you are looking the metformin tablet in your hand, it gives a different kind of the feeling. Same is true with all the medicines. Whether you are having a look on their diagram or you are actually feeling their package. So try to feel their package. This memory is going into your memory for a long time, and it generates a lot of interest for the pharmacologist. Unfortunately, we are taking this aspect for granted. We are trying to push it more and more. And we have also devised several other things also, like instruments we are using for the giving the medications. We have developed there at our institutions a kind of the set that we are calling Roma set. Probably I have posted the picture of that. We have developed it. See, anatomy, we have heard, everybody have heard the name of the bone set. We are managing, we are purchasing it. Same is true with the device Roma set also, various kind of the. See, a clinician with the 25 years of the clinical practice, he is daily putting the intragar. But if you are asking, sir, can you tell me the various part of the intragar? He won't be able to tell. He won't be able to tell you the various part of the drip set. But same opportunity can be taken, can be dragged into the pharmacology department. All the devices, important devices, day-to-day being used in the day-to-day practice. In fact, you will be surprised to know that I am into the pediatric practice for more than 16 years. And I myself have learned all these in the pharmacology department itself. I was not aware. First I have learned, then I'm giving training to my faculty members, to students also. So these are the measures through which we can make our branch very much interesting, very much enthusiastic. And then integrated learning or self-directed learnings, a lot of discussions have been made on this. Not much things, various modules can be developed related to this simulation-based teaching and self-directed learning. Simulation-based teaching is teaching on the various mannequins that have come up probably here also. Mannequins might be available in almost all the institutions as per the recent NMC guidelines. And integrated teaching means we are integrated the teaching with the other department, a department of pathology, microbiology, medicine, surgery. Then we can participate. Several good institutions are organizing interdepartmental meetings. Our residents, our faculty members can participate in interdepartmental meeting. So these are the various things that are the teaching learning methods. And this is the, again, so these have been the various timelines that have been given by the National Medical Commission. It is now in black and white. Initially, what was the thing that many faculty members or many head of the department, they were willing to send resident and faculty members to the various wards. But the head of the department or their faculty members were resisting that why you are sending, and because the atmosphere is being disturbed. There are many issues. But this is now in NMC guidelines. It is in the black and white. Okay. Each MD student needs to be posted for 2 weeks in medicine, for 1 week in the hospital pharmacy. Very important part. I'm not aware of how many medical institutions are taking this opportunity into a useful activity. Probably hospital pharmacy is available everywhere. And how many students have visited hospital pharmacy, by the way? I'm glad to know that here students are quite well versed. They are well versed. But otherwise, many of the institutions I'm going, they have never visited the hospital pharmacy. They have nothing to do with the hospital pharmacy. So in a hospital pharmacy is available, almost it is available, 1 week posting is, so you can see how the medicines are being kept, how they are being arranged at the time of the prescription, how a pharmacist is explaining, how he is selecting the medications, how he is explaining the use of the metered dose inhaler and other things. So all these things can be performed. It is an integral part to the pharmacology department, pharmacy. Microbiology department 2 week, again I have told that infection control is an important and antibiotic stewardship has been into the place. So this posting have been prescribed by chemistry department, various investigations, in anesthesia also 2 week posting to look after, and this is the very good opportunity in anesthesia department. In each and every anesthesia department there is a emergency card. Okay, and how many students have seen the emergency card? How many students are well versed? How many medicines are being kept in the card? Any idea? So whenever you are getting an opportunity going to the emergency department and in anesthesia department, because this is mandatory to these students. In the coming slides I will be covering all that. And dermatology, because dermatological disorders are very, very common. And many of the dermatology, I have seen residents, pharmacology, who have worked thoroughly for more than 6 months. In dermatology department, they have taken deliberately thesis on dermatology, and they are successfully running their dermatology field, and they are running like anything. With the pharmacology degree, it is not that it is the capacity. We have to come up from ourselves, from inside. We need to prove that we can do. If we are having experience, if we can do. I have seen surgeons with the experience of more than 20 years doing surgery, doing hernia and hydrocele, but they are not satisfied with their job. They are like, oh, क्या ले लिया, कैसे कर लिया, बस ये वही बोरिंग रोज सुबह उठना, 2-3 काट देता हूँ, गालब्लैडर काट देता हूँ. लाइफ में थ्रिल नहीं है, थ्रिल नहीं. So it means that thrill needs to become from the inner core of the heart. Okay, I have seen many of the anatomists. The anatomy was never their cup of tea, but my teachers also, Mehdi Hassan sir, he has taught me very eminent anatomist, and he has proved with the simple subject of the anatomy. He has proved from Kashmir to Kanya, everybody was aware of him. Unfortunately, he is no more in the world, but his passion of teaching. When he was teaching, means we were all lost during the teaching process. He was that kind of the excellent academician. So it is how we are taking our profession. It should come from inner core of our heart. See, I am having 2 specializations. I am having pediatric degree. I am having the pharmacology. And when I am comparing to both, I am feeling that pharmacology is much more excitement, giving much more excitement as compared to the pediatrics. So it asks what you are having in the core of your heart. Medical education department have been made, recently been introduced, and it is optional, but students, if they can have a kind of the experience related to medical education, it is very, very, very good. How many minutes are left, sir? 20. Okay. So posting under the district residency program are there. Probably you might have heard by now that from each medical college, students need to be sent into the district hospitals. But one point needs to be emphasized over here, that our students should not be utilized like their workers. They are having their separate jobs. It is in the black and white what they are supposed to do. They have to do their pharmacology related work. They have to do the basic kind of the tasks that have been given to them when they are working in these district hospitals. Means we are not sending our resident to become their additional hands. We are sending them for the benefit of the student, but it is a compulsory rotation of the 3 months in district hospital or district healthcare system. It has been advised in 3rd or 4th semester, offered in conjunction with the collaborating other departments and units. Students acquire expected competencies, and again that I have said that students should not be considered as an additional helping hand for departmental unit. One point needs to be given, important thing, that when you are going to the ward, okay, so there is an excellent opportunity there for the addressing antimicrobial resistance that can also be learned, or antibiotic steward. So this is a golden opportunity. Maybe we are not born, Douglas sir and me were not born in that era. We were not fortunate. You are fortunate enough that you are in this era where things are in black and white, and you are having several of the opportunities. Means those the things that were redundant initially, they have been withdrawn, and those who are very much related to the taste of the time are there in black and white.
So they are saying compulsory rotation for 3 months. Means once the student will go there, he will stay there for 3 months.
Yeah, he will stay in their campus also, or the campus should be nearby.
Yes.
Yeah. So, this is the first year where the students will be going to the district residency. This is the first year. CPME, this is the first CPME batch. No?
It is compulsory for 3rd, 4th or 5th semester. So how they will go after 1 year?
Yeah. After 1 year, our batch is coming up in that.
Yes.
Probably next year this district residency program will be applicable, and there may be teething problems with every program with this also, but with the passage of time, I think all the problems would be sorted out. But this is again a good opportunity, and training students with the teaching methodologies and assessment methods. See, when I was the medical postgraduate, I have never been given opportunity to learn or listen, at least listen. Learn is coming afterwards. Listen about this. But this is a good opportunity that we are having the various things, teaching methodologies, various teaching methodologies we need to encounter, and we can incorporate in our day-to-day practice also. Same is true that the concept is coming up, OSCE and OSPE. It was initially not there, but we can fully utilize its capacities. And in the CBME batch, sir, this CBME batch, it has been incorporated, and students have been asked by the examiner that they need to give OSCE and OSPE exercise during their MD postgraduate examination. Probably from the next batch, this will be into the practice. Through medical educations, I myself have learned several of the things, and it is really very much exciting that students, I was surprised to know that a student can be taught like these ways. It may be through the giving the project, small project we can give students, or through other kind of the things. OSCE, OSPE is one of them. Then PG student shall conduct UG classes in various courses. It was not initially there. Each and every PG student should be well versed with the various kind of the guidelines that are into place with the related to the competency based medical guidelines of NMC, with the postgraduate curriculum as well as to the UG curriculum. I have prepared a separate presentation on the entire guidelines of the CBME that I am going to present next week in Lucknow. So PG students shall conduct UG classes. So gone are the days when PG students have been kept away from that, they cannot interact with the UG students. You have to be directly in touch, and as sir and we were also discussing, if a kind of the lecture is being prepared by the UG students. See, 15-minute session can be taken by postgraduate student. It can give a lot of boost, a lot of confidence, boost of the confidence to the student uh, when he is directly involved with the PG teaching. And of course, the faculty members can observe and provide feedback to these teaching skills. So this is never think, and PG book is also in place. Various institutions have already introduced PG logbook, where we need to give details and duration of the postings that have been performed by the postgraduate students in the ward, OPD, casualty, various kind of the procedures. They have to keep the record in the PG logbook. Details of the teaching and training session attended, various kind of the workshop, various kind of the paper presentation, all this needs to be a part of the PG logbook. On the suggestion of the senior faculty members at National Association of Pharmacology and Therapeutics, I've been constantly demanded by the senior faculty members that I should, initially I was not incorporating a student as a member of the National Association Pharmacology and Therapeutics, but under the constant pressure I have bowed down, and we are working on that. Soon we will be opening gates. We will be offering students 3 years studentship. So as long as the student is the student of the MD Pharmacology, we will be taking nominal amount. We will be giving them the certificate. That certificate can be inserted in logbook, and that can be shown to the examiner. Fortunately, you will be surprised to know, I bet that there are the 50% chances that the students who are coming their examiner, they will be member of NPT. they are the 50% chances. With the passage of time, the chances may increase. So you can told them that, sir, you are also member, I am a student member. I am fully involved with the organization, not organization, but organization academic activities. Not only organization, but it's academic activities, teaching, learning activities, various kind of the workshop. So fortunately, we are having the platform available where that is exclusively for the medical doctors. Initially, you might have heard the other organizations, but none of the member of the NPT is not having without MD degree. Okay, each and everybody is fortunately having the MD degree. MD in pharmacology is the minimum criteria. So details and procedures, I was talking discussing about the PG logbook, details of the teaching and training session attended, details of the acquisitions of the various competencies. Students shall be trained to reflect, and their reflect should be mentioned in their PG logbook. So as per the current recommendations of the NMC, exposure to the seminar, symposia, conference is must, and because of that, surprisingly, sir, more than 200 papers were presented in Bangalore.
Yes.
Within a very short period of time, students have taken very much interested, and some of our students, we ourselves, we have promoted students, and to some of the papers, I have to give madam a recommendation that it is, since the requirement for sitting in the exam, a paper can be taken. So this is good opportunity. Several of the conferences, symposia and seminars, we are thinking to organize in coming days, but this is a part of your syllabus. This is a part of your curriculum now. Okay. Trainee shall attend accredited scientific sessions, CME, symposia, conference at least once a year, and there should be at least 3 during the entire PG course. So it is very important development, and it is mandatory. It is in black and white, and this training, it is also mandatory. Initially, the promoter of these trainings, ACLS, BCLS, basic cardiac life support, they have initially the trainers or the advisors to the national medical commissions from the pharmacology background. So they have initially they have introduced this. that we want that our pharmacologist needs to be covered and needs to be trained with this. You will agree with me, as a doctor we should be having well versed with this. It is very much true that pharmacology is not doing much with the patients, but as a basic degree, because of virtue of our basic degree of MBBS, we must be well versed with the basic cardiac life support and advanced cardiac life support. This is now essential. It has been into the NMC gadget. Okay, and you will agree with me, we cannot comment. I was traveling to Dubai last year, and that was the story that suddenly some person has collapsed. They have immediately called, is anybody doctor available in the flight? So I said, yes, I'm available. Person have collapsed, and he was having a lot of issues with the cardiorespiratory. I provided him the various things that I was aware of. Massage in the form of the little bit of the patient is revived during the flight. So anytime as a doctor you can be challenged with all these, and if you are well versed with this, you will be really feel proud from the core of your heart that you can be a savior of the heart. And we are looking several news in the newspaper also, in TV programs also, that a doctor came up like a savior, he has saved the life. So these are the important issue. These are the now as per the advice of the NMC in the curriculum. Same is true with the training of the PG with the computers. See, training of the computers and PG, we have, how many of you are having the laptops? Almost all are having the laptops. Probably majority of them are well versed with the PowerPoint. How many are well versed? No, I wanted to ask an important question. How many of you have taken the professional training of the PowerPoint presentation? How many? See the difference, sir. So this is the difference that I wanted to point by making this slide over here is that, see, there are the difference. Running a MS Word, how many have taken the training from the expert of MS Word? How many? Sir, none of them have taken. Excel, how many taken? But taking the Excel training is very much mandatory for your thesis work. You have to learn. So my personal advice would be there that if you are getting an opportunity, probably you are not, there is no scarcity of the time. Try to feel a difference. There is a difference of become aware of the gadgets, aware of the MS Word, PowerPoint presentation and Excel. It is not sufficient. Sufficient is you must be getting a professional training, and you will, you will be, means feeling a lot of difference after getting the professional. You will say that I was not aware of this button was there and I was not using it and it was doing magic. And I can explain to my colleague also, see, this can be done and it can animate and it can be making the presentation very beautifully. Okay, so try to gather this knowledge professionally. Okay, so all the postgraduate students must undergo training. Training is not just duration. Duration has not been mentioned, but all these programs are available by the sir. Those who are running the computer institutions, they are having, sir, 1 month, 2 weeks for the MS Word, and Excel is 1 month, and not daily classes also.
But then, can we send them to the private class?
You can, if students are ready, you can hire them in your institution also.
During classes only, 9 to 5 p.m.
They are available separately on payment basis, and if students are more in number, say for example like in GMC, you can hire them. You can give them the package that we will be giving you 10,000. So you need to in 10,000. It is when it will be divided by the student, it will be a meager amount. Okay. So it will be bigger amount. So you can ask the person who is well versed, he can come to the department and he can give professional training related, at least 3, MS Word, PowerPoint and Excel. Okay. So I feel it is the area, because why I am emphasizing it again and again, I have worked in the Manipal Ekinova, and at that time, like you, I was having little bit knowledge of the MS Word, little bit knowledge of the PowerPoint, but my boss has, he has observed my skills, it is not up to the mark. So I will train you. He has trained me fully, and I agreed many things I have gained there as a professional development. And same is true with the communication part also. Communication is very, very important for the MD pharmacology people. Okay, it can be means you can forgive a student of the MD medicine, but you cannot forgive MD pharmacology, because everywhere he has to communicate. Where you are, whether you are in the institution, you need to communicate with the students, and you must be having confidence, lot of confidence. Same is true with the industry. At least 50% of the industry work is through communication only. Okay, you are being given project, and effectively, more effectively, you are communicating. And for me, the person like me, there were a lot of problems. I've been from the Hindi medium background. Major part of the life I had to learn English speaking. Still, it is being reflected in my tone also, that I am not that well versed, that a English speaking person. Fortunately, my wife, she is from the English medium background. There are a lot of differences, but as a communication, you must learn it, and with the passage of time, you will become well versed. All these are the reflexes. More and more you will try to develop, more you will become proficient with this. So don't take all these minute things for granted for the as an MD students. Okay, and see, GCP training is again very, very important. Sir have organized, through this All India Institute of Nagpur, and we have received an overwhelming response. The registered participants have overshoot the desired number. We were not expecting more than, madam was also a faculty on that. It was huge successful, and through NPT we are trying to give, and NMC have given little bit flexibility related to that you can participate in online sessions, and the online session that is being generated, certificate is being generated, that is valid for you. Okay, you are being counted as a certified GCP trainer. So at least this relaxation criteria have been given by the NMC. So all students must be fully versed with the ethical aspect of the clinical research, clinical trial, or GCP, because for the pharmacologists, again, they are the bread and butter. The assessment, they have given some, NMC have given certain criteria how students should be assessed: case presentation, case workup, case handling, then laboratory performance, journal club, seminar, case discussion. Some of the activities we are already doing in the department, some of the activities we need to incorporate. Exposure to research skills is must by the student to complete online research methodology course. BCBR is one of the course that is now mandatory by the MD students. So certificate can be generated online, and again this certificate can be attached to your logbook, and it can be shown at the time of the MD exam. So additional research projects are being devised by the NMC. It should be different from your actual thesis. It can be small, and if research thesis topic is on related to diabetes, you can take the additional researches to some another topic or some another activity, clinical trial or clinical research. It is under the guidance of your senior faculty members. It can be done. So now there are there are the plenty of the opportunities, and please give the attention to this slide, exposure to clinical skills. And as such, NMC has devised several mechanisms to expose MD pharmacology residents to the clinical skills. A thesis topic can be provided related to the clinical domain. My postgraduate student is doing topic related to the diabetes. She's going, attending the patients in the medicine OPD. That can be done. Again, this is a good opportunity to give the clinical exposure. Posting in the clinical departments. I have shown you the slides. And district residency program is again one of them. And then training in clinical skills, I have already explained. So there are plenty of the opportunities by the MD, to the MD pharmacology students which were not existing before. Now this is the most important thing and little bit tricky. How we can correlate the teaching and training of our pharmacology, both UG and PG, to the wards. It is very, very challenging. And till now, none of the institutions of all over the country is touching this aspect. Unfortunately, we are keeping our students, our UG students, postgraduate students, not directly in touch with the patients. Maybe it is possible because we are not having blueprints in our hand, we are not having modules, we ourselves are not trained how to tackle this opportunity, how to address this issue. So at NPT, we are constantly working on that. We are trying to develop blueprints. Dakle sir is also directly involved with me. We are planning several modules also where we can address this issue, bench to bedside. So, but there are the certain kind of challenges, you will agree with me, why this area has not been covered, why many institutions, even the institutions which are having several well-equipped facilities, lot of department load, very good departments of the related to the clinic, very good department of pharmacology, why they have not touched this? Challenges are because there are the wards problem is wards may be overcrowded and there is a lack of the cooperation by the colleagues in the department. First we need to establish a rapport with them. Only it is possible with that. Disturbance of the ward atmosphere by the presence of the teaching. The other clinical departments are taking our student as a hostile, why they are coming, what they are doing. It is disturbing the sanctity of the atmosphere of the clinical wards. If we can develop such measures which are not disturbing the entirety or sanctity of the department, then this issue can be solved. There's a important thing, we know it already, lack of faculty training. So as a faculty, we need to first learn how to address this issue. After we will become well-versed with it, then we can try it on to our postgraduate students. And gradually, I'm keeping my finger crossed. I'm quite confident with the passage of time, we will be one day be able successful to take our undergraduate student to the bedside also. And then, of course, there's a lack of desire, but not much lack of desire. Now, there are more of the enthusiastic faculty members, more than enthusiastic than me also, who want to touch each and every aspect. So I was doing the SWOT analysis. There are a lot of strength, weakness, opportunities, and threats related to that. If we are doing the SWOT analysis of that bedside teaching and training, I find there are a lot of opportunities in that. I will not be going into the detail of this SWOT analysis, but we can devise newer modules for teaching and training that can be completed bedside, that can be completed with the patient, that a student can be assessed related to these modules in our department itself, and then we can prepare the various modules related to computers. Then case-based studies are must. See, we are not allowed to touch the patient. Do you think we are not allowed to touch their files also? No, it is not so. On the request, if we are having very good relations, maybe all the residents are intermingled. There are the mass in every institution. सारे रेजिडेंट बैठते हैं ना वहाँ जाके, तो ऐसा नहीं है फार्माकोलॉजी के स्टूडेंट की फ्रेंडशिप नहीं रहती मेडिसिन वालों से. तो अगर आपकी रेपुटेशन है तो आप उसे रिक्वेस्ट कर सकते हैं कि मुझे थोड़ा फाइल आप मुझे असिस्ट कर दें, मेडिसिन दिखा दें जो वहाँ बेड साइड रखी हैं, दैट आर बीइंग यूज्ड बाय द पेशेंट्स, एंड इमीडिएटली यू कैन टेक द पिक्स of the file. If they allow, you can take the pics of the various medications, and all collecting this information, you can come to your room and you can analyze from pharmacology point of view. It is not disturbing their patient, and happily they will allow. And one more thing is, you can give them number that if related to any kind of the drug query, you are feeling any kind of the problem related to dose, related to drug interaction, related to adverse drug reactions, please take my number. You can call me at 12 o'clock in the night, 3 o'clock in the night. I will be available as a pharmacology postgraduate or pharmacology faculty. It will develop a lot of respect, a lot of repute to your clinical. See, they are not need of us. We are in need of them. So we need to fill the gap. Okay. So case related to studies in the wards can be done. There is no, and then interdepartmental participation in clinical case presentation. It is happening in each and every institution. When I was working in clinical pediatric department, this was the usual practice. What at the most your students or postgraduate student can do on the request of the head of the department, they can ask that our resident will occupy the back chairs. They will be making notes. Whatever the discussion is being done, they will keep on making the notes from pharmacology point of view. At least it will give you the opportunity what is happening. What is happening actually there with the patient, what they are doing. Okay. And meantime, maybe the day come that the whole of the distance may be reduced with the clinicians also. And many of the assignments again can be completed in the wards directly, going to the ICU setup, in the pharmacy setup, in the OPD and the wards. We are in the process of developing various kind of the modules, case sheets that can be filled through the pharmacology point of view. We are in the process. We have developed, this is the simulation lab. Simulation lab is probably mandatory everywhere, and students are having good opportunity. CAL lab needs not to be confused with the experimental lab, where you are only performing the students. I have already given you the hints. MS Word that you need to learn, PowerPoint that you need to learn, Excel sheet that you need to learn, that is also part of this CAL lab. Okay, searching the drug information from the Google, from the Micromedex, using of the establishing of the clinical research BE lab or research lab can also be taken. A small part of the department can be designated. You can initially start with one bed. You can establish a monitor. I feel within the 15,000, it can give the student of the what he is supposed to do in BE lab. Students are directly after MD passing, they are being appointed as a physician in BE lab. They don't know ABCD of the BE. So that can be, simulation lab can be developed in the department itself. Okay, so computer lab I was taking, then simulation lab I was taking. Here in our medical college we have developed simulation lab related to the route of medication administration. A lot of advertisement we have done. We are successfully doing the drug related experiments. See, there are two kind of the labs. One is the simulation lab. We have developed a ROMA lab that we have called, catchy name little bit, ROMA, route of medication administration. So in our, we are having 10 desks where all the kinds of the basic exercise related to drug administration, intramuscular, cannulation, starting the IV drip set, inhaler, meter dose. So 10 we are having this, and we are successfully doing it there. So one of the area of your department, because you will agree with me, Douglas sir will agree with me, when the external examiner is coming, you cannot expect the external examiner student to take to the simulation lab. Okay, so prepare your own lab also. Simulation lab can be separate. Okay, and if you are preparing your own simulation lab related to route of medication administration, it can be devised. The costing is around, including the mannequins, costing is around 2 lakhs, less than 2 lakhs. I am including the cost of the table and chair also. It is not much costly, because on each and every desk, you need not to put mannequins. Some of the labs, how you need to put meter dose inhaler, how much it is costing? 150 rupees only. Nebulizer, 2,500 rupees only. So in that sense, a separate miniature lab can also be created. Rational pharmacology exercise related to the rational pharmacology needs to be given, where we can teach students that if a cough patient is coming, you can show them directly that these are the syrup available in the market. I am having all the syrup in my department in a shelf. And whenever I am teaching this exercise, I am picking up the bottle of the Duracillin, that this is the Duracillin. You need to decide whether I need to give. It gives a lot of difference. Okay, it gives a lot of difference. All the cough syrup are there. When students are picking up, they are making mistakes. They are giving the suppressant in productive cough. Immediately I am telling them, no, this cannot be given. This is suppressant. This is the productive cough. So they are more receptive. UG students are more receptive. So through these way, you can make your own pharmacology world and teaching and training much more interesting. Then prescription audit we are already doing. We can perform. It is not that difficult. And we are showing a student.
Project 9, how to give an intramuscular injection.
We are showing these videos.
Is injected well into the muscle.
Before I am giving them the demonstration of the intramuscular injection,
A clean work surface.
I am giving the demonstration with this video.
A pair of clean gloves, a vial of medication, a 5 cc syringe, 2 18 to 20 gauge needles, one should be a safety needle, cotton wool or gauze, an adhesive bandage strip. Follow these steps. Greet and positively check the patient's identity. Check the following on the medication ampule or vial before proceeding: the correct name, volume, and concentration of the medication, the expiration date, abnormalities regarding consistency and color of the medication in the vial. Draw up the medication for intramuscular injection as described in Project 6A. Prepare your hands hygienically and don clean gloves. Choose the injection site for the dose and expose the area. There are several areas of the body suitable for giving intramuscular injections: deltoid muscle, vastus lateralis muscle.
When I am giving student these kind of the exercise, I always make it a point that students are making diagram of related to that. I am giving them the sheets that please make a diagram, anatomical diagram, which are the various muscles, and prepare a diagram of the needle and syringe, where you need to write the various parts of the needle to syringe. See, there are several things still there in our pharmacology. We can make them interesting. So before we are going student to ask how this intramuscular injection is being given, we are giving them a sheet, we are giving them an exercise, and student is much more receptive. At least 10 minutes we are giving for drawing this, for drawing the diagram. And students are taking a lot of interest. And then we are showing them the video like this.
Ventral gluteus muscle, dorsal gluteus muscle. Wipe the injection site with an alcohol pad for 30 seconds in an outward circular motion up to 5 centimeters around. Allow the site to air dry for 30 seconds. Open the index finger and thumb of the non-dominant hand about 2 inches or 5 centimeters spot, and then gently spread finger and thumb to tense the tissue. Ask the patient to relax and take a deep breath. As he or she inhales, insert the needle at a 90-degree angle in a quick, dart-like motion to an appropriate depth and ensure that the needle tip enters the muscle properly. It is essential to aspirate before depositing the medication into the muscle. To do this, gently withdraw the plunger before
So we are pausing the video, we are explaining the video in great details, in depth, by pausing it various steps so that a student can make a list of the various steps, and then if we are showing, keep on showing them these kind of the videos.
the injection in order to avoid
It is
an
making the
intravascular
topic
injection
very much
and
interesting.
a possible medical emergency. If you aspirate blood, withdraw the needle and prepare a new syringe. If no blood is aspirated, you can inject the medicine as follows. Continue to hold the skin and push the syringe plunger while slowly counting from 1 to 10 for every millimeter being injected. When all of the medication has been injected, promptly withdraw the needle and apply pressure to the injection site using a gauze square to prevent bruising or the formation of a hematoma. This will also minimize medication seeping into the subcutaneous space. Certain medications may require massaging of the injection area for a minute or two, but for others, this may be contraindicated. Apply an adhesive bandage strip if necessary. Discard the used syringe and needle in a designated sharps waste receiver. Do not recap or remove the needle. Remove gloves and discard in a suitable medical waste bin.
I am quickly going through these slides. This is related to the various training to the internet. Internet is a very important tool for learning all the activities for MD. We cannot think of our life without the internet. Several of the videos are available on the internet. I will be quickly going through this that can explain the mechanism of action of the
cytotoxic drugs.
So if I am taking the lecture of related to this topic, I am first showing the
used in conventional formulations
video related to that.
as they also
It generates a lot of interest in the mind of the students.
drug delivery systems on
It
the
is
other hand,
related to targeted drug
enable
delivery
high
system.
efficacy with
It is
limited
freely
side
available on the
effects.
YouTube
These
elsewhere
issues may
also.
be mitigated by lowering the dose, but lowering the dose leads to further complications. This calls for a targeted drug delivery mechanism such as liposomes. Liposomes have salient features such as they are composed of natural lipids, they are biologically inert, biodegradable, and weakly immunogenic. However, creating true liposomes is expensive and employs several complex processes. Cipla has developed two liposomal formulations for targeted drug delivery, liposomal amphotericin B, Forzol, and
This is related to liposomal amphotericin B.
Oncodox. Pegylated liposomal doxorubicin can be used for chemotherapy for certain types of cancers. Liposomal doxorubicin is formulated by remote loading doxorubicin into plain pegylated liposomes containing an ammonium sulfate gradient. During the creation of the liposome, the doxorubicin complexes bind to one another and form a long inflexible band of doxorubicin sulfate aggregate inside.
So keeping in mind paucity of the time, I am quickly going to the other slides also. There are the several apps available on the our mobile phone, and it depends on us how smart we are in using our smartphone. This can be a tool for teaching and training purpose also, and Medscape is one of the apps. Probably everybody have heard the name of the So we can develop the various practical related to use of the Medscape also. Apocrites, important. I am telling about all these apps because doctors in their clinics are using these apps professionally. Why not to train the students right from the beginning when he is a UG student? So we can take the advantage. OSCE and OSPI is entity is fully established by now. There are the certain guidelines to organize OSCE and OSPI in our department, and with the passage of time it is coming into the postgraduate exam also that OSCE and OSPI station needs to be developed during postgraduate examinations also. There are clear-cut guidelines. I am quickly going to the highlights of the NMC curriculum related to medical education's involvement of the postgraduate student by now in UG, teaching, posting in the clinical departments, we have discussed, district residency program, we have discussed, ACLS, BLS training, participate in the national workshop, paper and poster presentations, BCBR cycle, GCP training, all these are the mandatory by now. And these are the suggested reforms that we can modify our teaching and learning method. We can modify the method of assessment. All these are the take-home message, professional exposure to the computer and internet-assisted things, industry and clinical research posting and exposure, sessions on correlation of the pharmacology to the therapeutics, exposure to the clinical practice. All these references have been taken by this dossier from national available on National Medical Commissions. There are some of the acknowledgement. I am deeply thankful to Dr. S.P. Dhaneria, Dr. Bhadyal, Dr. R.K. Dikshit, Dr. Padanja Uday Kumar, Dr. Chetana Desai. Dhakle sir has given me this golden opportunity to interact. It is really a pleasure. I have really enjoyed the entire session. And Dr. Geeta, Dr. Sukanta, and with these words, I am closing my presentation. Thank you very much for listening to me and for giving me an opportunity to interact with you all. My number is freely available on WhatsApp also if you are having sessions, questions that has not been covered due to paucity of time. I am freely available for interaction through phone calls, on WhatsApp chats also. For any kind of the query, you can directly contact me. Thank you very much.
Thank you, sir, for your interesting presentation on competency-based medical education in postgraduate training, especially in MD pharmacology. Though you have pointed out n number of new guidelines they have suggested, most of the guidelines we are following, at least at AIMS and GMC Nagpur. Few may not be there, mostly 10 or 20%. That can be included in our future course of time, because just like bedside clinic, others, they are not included previously. So at present, it may be things to be more difficult for all of us. But as the time will go on, it will again may be possible for all of us. And Dr. Kamal sir is there. He is very much active in CBME since inception of CBME. So if there is any difficulty, whether AIMS Nagpur, GMC, IGMC, whatever it may be, or throughout the India, anybody can contact to him. So now the forum is open for discussion, or any questions are there, you can directly go ahead with the Dr. Kamal sir. You can go ahead.
Sir, I want to ask what additional benefits the DRP, that is the District Residency Program, can offer to the postgraduates, where institute is a tertiary care teaching institute. Like we have exposure to patients, and we have many duration. The duration is there for clinical exposure. So what additional benefits the DRP can offer? And the duration is very much like 3 months. And the postgraduates are supposed to do many things during their 3 years course. So your opinion about the DRP?
District residency program have been introduced by Government of India by taking into consideration of the several points. We all know very well that we have all passed through the pandemic of the COVID, and where which have reduced the identity of a doctor to a specialist. Even pharmacologists have been directly involved to the teaching, to the training of, taking care of the health of the COVID patients. Many of the resident faculty members have been posted in the wards taking of the COVID. There was the paucity of the doctor at that time. And meantime, probably the government of India through these kind of the program, as government of India and it is being think that there is a paucity of the doctor in the country. So government of India wanted to expose all the doctors, not from the pharmacology department. It is the mandatory for all the other residents also, residents of other fields also. Once they are having the direct contact of the district hospital, they came to know about the various challenges that are being there. Otherwise, if they are in the setup of the hospital setup, see, the challenges in the hospitals are different. Maybe it is different at the PHC, CHC level, which is the first place of the contact. So, if the students can, right from the beginning, can have some idea, so it will be more beneficial to a student. And moreover, I have shown one of the slides that there are the national programs of Government of India, and Government of India want to introduce all these programs right from the beginning. So students can have hand-on experience on all these programs. These are not possible probably in our hospital setup, in our institutions setups. These are the some of the things. Keeping in mind the experts in the NMC have introduced district residency program. There are certain dispute on the duration that are under the discussion, but I feel there is no harm in sending our students and keeping our the confusion in our mind that all these residents may not be utilized as a working, and they have given clear-cut guidelines that these are the things. Students are not going them to help in their activity. They are going them for learning their activities.
So
Related to
ultimately,
their
they will act as a reserve police
Maybe.
or reserve doctors, and
Maybe.
whenever there is any emergency, they can send them to the respective places. That is the main purpose. Sometimes it may not be useful, sometimes it may be useful for the government setup.
And I am in the contact of thousands of the doctors across the country. Sometimes it is not possible. Girls have been married to a place where medical institution has not established. She has done MD pharmacology. If teaching job is not available, pharmaceutical industry is not there, district hospital is available, job is available, she can immediately be absorbed at a lucrative salary on that. And she may not feel hospitable there. She feel quite comfortable because she is already exposed to that environment. Maybe this is one of the reasons. So we need to keep all the aspects open to our postgraduate students. That is the motive behind this district residency program.
Next question. Go ahead.
Good afternoon, sir. Firstly, I would like to extend my gratitude on behalf of all the JR1s from GMC to Dakle sir, Kalikar ma'am and Kamal sir for giving us this opportunity to come and attend such a wonderful lecture. So actually, I have a question and a suggestion both about the interdepartmental collaboration that you were talking about. My suggestion is, I mean, it's a doubt that I have. Is it possible that residents from all the department actually have clubs wherein they come and discuss cases with each other? What would be your thought on that?
Yeah, it can be done. And to begin with, as I have already suggested, see, interdepartmental seminar and all these things are happening. So if our residents will start going there, making their own notes, residents and the faculty members of other departments, they will feel quite happy that, and maybe at many times we can give our inputs.
Yes.
Sometimes I being received a phone call that this is the azithromycin dose I need to use in 20 kg child. What should be the dose? I am unable to. So immediately I am quite well versed with all the. If I am not, I am looking through the textbook, and within 5 minutes I am getting back to him, explaining. So these are the opportunities to develop an interaction. Okay. So with the passage of time, these interactions will gradually will develop. We will be able to establish lot of bonding between the preclinical and paraclinical departments. And of course, the day can also come when the separate clubs meetings can be organized with the resident member, and resident members can also taking the advance in that. They can also suggest and they can organize. It is very good idea, in my opinion.
Definitely is a good idea, no question. Next, go ahead. Madam.
Good afternoon, sir. I want to ask about, is there is any change in examination pattern in CBME based syllabus?
Yeah, some of the slides I have really missed because of the paucity of the time. It has given the details, and probably I will try to cover through this YouTube channel also. My next session is on 27th on KGME Lucknow, where entire session is based on detailed in-depth discussion on the how NMC has suggested. There are little bit changes in the pattern, how it has been suggested thoroughly, that how we need to take exam. If the exam student needs to be given long case, what should be short case, what it should be, what are the various exercise, osteolos, each and everything is in the black and white. I can give you the text related to that I am having with me, and same can be, I can give you the PowerPoint presentation related to that. Each and everything is available. I have not covered because of the paucity of the time, but it is there.
Next.
Thank you so much, sir, for giving this lecture. We are really happy that we were part of it.
It's my privilege also.
Yes, sir. Thank you, sir. And I just wanted to ask this. Sir, we have seen that patients have been skipping doctors and going to other doctors because there's this friction between them, right? They want to connect more with the medications they are taking, not just the doctors, but the medications they are taking. What do you think can be our role and in developing trust between a doctor and the medications as pharmacologists in future? Can we guide them? Can we have this special sector just for counseling patient on developing trust on medications? Like, we are pharmacologists, we are really good, like we're well versed with drug information. Can there be a special sector? Like, patients go to counselors for psychiatric treatment, like psychiatric therapy. Like, can there be the sector, like, just to develop a trust between medications and patients? What's your opinion on it?
Probably if you have thoughtfully seen my slides also, there are things, therapeutic adherence I have discussed. One thing is that, and each and everybody, you are now well versed with the communication aspect that was lacking initially. Communication, a lot of thrust being given, and there are the communication related exercise also. Therapeutic adherence is one of them. So we can be of utmost importance as a pharmacologist that if a particular person, and it is very much challenging aspect in the psychiatric wards, that patients are not taking the drugs regularly. Same is true with the asthma patient, tuberculosis patient, diabetic patient. Once they are getting symptomatic relief, they are. So our role can be important as a communicator, as a counselor, and I can see the future where our residents can be called from the pharmacology department, that they can be utilized, whether they can be utilized as a trainer, as a counselor, directly to the patients. And it will also reduce the burden of the clinical doctors also.
Yes.
And it will again develop an interactions. See, if we want to develop bonding, we have to take initiative first. Probably Dakle sir has not contacted me. It is me who has first contacted Dakle sir. Okay, so if my job is, I need try to initiate. If we will be taking an initiative, results may be beyond our imagination. You can see in my life that one by one, I was not able to imagine. I was fully happy with my life, and I am in touch with the more than 250 head of the department, and we are running such a wonderful show on the WhatsApp. Very good discussions. Each and every person is the master of his field. Very good discussion. No good morning, good night message, no festival greeting. It is very tight atmosphere there, and excellent. So similar kind of the things can be developed elsewhere also. Your idea is very good, and I can see very good role in the future coming days.
Thank you so much, sir.
So, if there are no questions, now it is your question. Go ahead, go ahead. Last question.
Sir, good afternoon, sir. Sir, it was an excellent presentation. Sir, I would like to ask one thing. What would be the status of bioassay in the new CBME pattern for postgraduate students? Like in MUHS, we have half of 150 marks a bioassay is allotted to bioassay in MD Pharmac curriculum for practical exams. So what would be the status in the new CBME pattern?
You are a faculty member?
Sir, senior resident, GMC.
Senior resident. Okay, senior resident. So, you will yourself give me the answer related to that. We are producing MD pharmacology students, and what do you think, how many students going into the practice, they will be needing the expertise of the bioassay? I am into the field and active field in the past 5 years. I have not come across even a single student who is doing bioassay after postgraduate in a job, I mean to say.
Yes, sir.
He is teaching a student.
Yes, sir.
He is developing protocol.
Yes.
He is working in pharmacovigilance. He is working as a medical director, clinical research physician. But bioassay is nowhere.
Yes, sir.
So it is probably a small part. Okay. So we need to give the importance is what importance does it have in our life, to the life of the students. If the students are not interested, we can give them the introductory knowledge of the animal experimentation, that is fine. Yes. And second part of your question is, what is the current status now? I have given the answer in one of the slides, that animal experimentation has been withdrawn from the category of mandatory. It is desirable. Bioassay is desirable. Maybe it is because of the reluctance of the faculty members. I cannot comment on that. But see, we are having another important area. How many hours we are having in our whole day? 24 hours. If we are taking some hours, we need to sacrifice for others. If we are thinking we need to go to take our students to bedside, developing bedside clinical pharmacology, we need to take hours from these 24 hours. We need to sacrifice bioassay.
Yes.
Then this can be developed. And once this will be developed, the haunts of the bioassay will no longer will be in our mind.
But my suggestion will be.
Bioassay as such have been completely, not completely withdrawn, but it has not been desirable in the current guidelines. You can show to your institution, to your university also, guidelines that bioassay is not mandatory now.
As the sir is said that it is not mandatory. But suppose it is going on in some institute. For example, in GMC and AIMS, we are going ahead with the chicken ileum. It is nothing wrong. The second question was your about the marks. Previously, it may be 150 or 200. It can be reduced to 50 or 25. And that marks can be added to bedside clinic also. It depends on institute to institute, just like ours, we are independent, we can do anything. Yours comes under the MUHS. So that may be modified by the respective universities. But it is good, nothing wrong.
It helps to learn the therapeutic.
Yes, sometimes it may be useful while you are doing the animal studies in pharmaceutical companies also. So totally we can't ignore. You can reduce the time as well as the marks given to the respective units.
It is not of prime importance. It is of important, but it is not of prime importance.
Yes.
We need to think of it. Like I have gone for MD examination in Bikaner, so to give them their MD students to the animal experiment idea, on that day they have drawn rabbits and they have kept rabbit experiments. That it is simple and it is completely fulfilling the requirement also that animal experiments have been performed. It is quite easy. It has given the idea. It has given the experience and things have been completed. Bioassay in that sense little bit complicated also, that can also be think upon. Rabbit eye experiment is quite simple.
It comes under good to know, not under must know.
Yeah, it is good to know, but not must to know.
Yes.
Sir, can I ask last question?
Last question.
Sir, as a pharmacologist, we are also having avenues in, say, drug development or regulatory, wherein we need to know animal toxicology data, we need to understand animal toxicology data or pharmacokinetic data. Those aspects have not been thought upon by...
It has been discussed, some of the slides, that Data we need to train student.
That was only, sir, in analgesiometer. Some
ED.
efficacy models were just listed, but that is not
See, ECG is a machine. To
animal toxicology data.
ECG,
sir.
ECG is a machine. It is a machine. It is developing a stream.
One of the hospice stations.
We are diagnosing the various diseases related to cardiology. Is it mandatory for a person who is well versed or cardiologist that he should identify each and every equipment of the machine itself? Machine is not that important. The strip is important.
Yes.
Okay, so that is the answer of the question. We need to train students how to interpret the data of. So
Exactly.
it can be done without in-depth study of the animal experimentation also. That can be possible. Okay, again my question is, if we are taking student to the bad side, we have to seriously think of. Because with the passage of time you will see why we are thinking again and again with all this, because there are plenty of the times exercise are not there, things are not in our life. When all these things have been introduced to our lives, we won't be having that time probably with all these. Okay, we will be having limited time, and these are the demand of the day.
Anant and Chitali, do you want to ask question?
One question from my side, just one query.
Yeah.
When we see the format of logbook which is issued, so in that there is only PG student has to do the entry of experiments or whatever PG activity he had performed, not the details of that activity. So is there any provision of a journal for postgraduate student? Is it following in any institute? Journal means what they had done, what experiments they had done, they have to write down that experiments in that journal, and they have to be certified.
Unfortunately, text related to that
Yeah,
are not available.
it is not. It is missing
it is
in
the demand
logbook.
of the day also.
Yeah.
Logbook is little bit different thing. Logbook
Yeah.
is making
Making
record.
just the entry,
That
and it's a
student have
record.
done this.
Yeah.
But in the logbook itself, you will see we have discussed reflections also.
Yeah, reflection
So
is
students
there.
are writing their reflections. So few pages can be left blank, where a student can write, and that can be a very useful exercise for a student. Definitely we are in need of developing a very good this
Journal.
text or journal related to postgraduates also.
Yes, sir. Where they can put the all details of the
I
procedure.
I do agree.
And the logbook can be extended according to each department.
Yeah, there
It
no
can be as
restriction
small
in
as
the
20
logbook.
pages, it can be
Yeah,
as small,
it can
as
be
long as
tailor-made.
100 pages also.
Yeah,
Depends
it
on
can
you.
be tailor-made.
Yes.
Maybe you are the person who can develop the best logbook in the country.
Yes, yes.
And if you allow, we will be able to give it through the NPT to all the country.
Yes, yes.
Fellow of the country.
Definitely.
Because knowledge is, by sharing knowledge is increasing. We are believing at
No,
NPT.
there is an entity called as portfolio also that can also be maintained. The logbook,
Yeah, yeah.
because in advanced course, I have done my advanced course in medical education.
Yes.
We submit portfolio at the end of 1 month. Whatever discussion has happened, as an e-portfolio we submit. Just in the logbook there will be entry. The supporting document will be there in the portfolio.
Sir is very much right, and portfolio with the passage of time is gaining a lot of importance. When you are going to for interview, it is the portfolio which is being seen by the
Looked upon.
interviewer. So portfolio is also coming into picture right now, and it is very useful entity. Fortunately, it is now available, and nowadays it was not available. We were not that fortunate in those days, but lot of opportunities, lot of things are available in today's pharmacology world.
Yes, sir. I have a doubt regarding whatever the mandatory things, psychomotor especially. They are told that those are the competencies which are need to be performed independently, and those which are with the support. Okay.
Or under observation.
Under observation. Sir, especially the one which are dependent, do they need to be certified? Like how we have in undergraduate, no? These are the certifiable skills.
Certifiable skill, their details.
No. In undergraduate, these are the certifiable skills.
We are having 5.
Unfortunately, they have not given these
No,
to
because-
postgraduate. Undergraduate, they have given.
Because the proficiency is graded always. So dependently means once I have done
Certified.
like independently. So does that mean that he is proficient? No.
I feel that a lot of work has been done on the UG curriculum, but still not much work done. Still work is left on PG curriculum. With the passage of time, all of your suggestions may be probably being incorporated. by National Medical Commission.
There may be revision 1, 2, just like the amendments. It will come in next years also.
It is a step by step.
It's a continuous process. It will be there.
It will be there.
Yes,
All
sir.
of your suggestions are important.
Just like
With the passage
NDC
of
to
time,
rule
we
to.
will be able, we will witness
Yes.
all of these suggestions came into black and white.
Yes.
So with this, I think.
Sir, last, the technical skills, no? Because nowadays Microsoft certified trainers are there. Those online trainings can also be.
Can be there.
Yeah.
And certificate, I have told they have allowed the
No,
certificate.
you were saying no to bring some person for training of IT related things. So some institutions they are conducting training.
These are not the mandatory. I have suggested it from myself.
No, I agree. Some rather than bringing some other person, these are online can be there and as a proof.
Best is one of your residents can get it trained and he can train all the residents,
Yes.
fellow residents.
Yeah.
He can take 15 days training. One resident can take MS Word, one in PowerPoint,
Yes,
another
yes.
in Excel, and with the session jointly organized in the department, and everybody will.
There
enjoy
can
it.
be n number of ways to go at that one. If
Student
somebody,
themselves. See,
if somebody
they have
is,
already told that students are no longer to be treated as students. They are teacher. They have to actively participate. When we are making them the teacher right from the beginning, day one, okay, why to be hesitant in developing all these sessions also? We can take, many of our students are ahead of us in the software skills also.
sir, thank you once again for your deliberative talk, and mainly for this you have done at least 1 hour and 45 minutes with enthusiastic energy. Once again, thank you so much. Thank you.
Thank you, sir, for a very interactive and fruitful session. All our doubts were catered to and very satisfactorily answered. I now request Dr. Mrunalini Madam to kindly present sir with the memento.
Thank you very much. I really enjoyed.
I now request Dr. Chaitali Madam to please kindly hand over certificate to sir.
Thank you. It is really.
Yeah, we'll have a group photo now. इसके पास लेंगे सर, ये हटा के ले सकते हैं सर, ये हटा के
And I am happy that all of you are quite awake during the entire session. Otherwise, there lot maybe yawning in between.
और सब लोग खाना खा के नहीं आए। देख बेटा। और आ जाए। आओ ना बेटा।
मेरे ख्याल से सारे